All right, my name is Samantha Wasala. I am the program evaluator for the Cancer and Chronic Disease Prevention Bureau. I mainly oversee a lot of our evaluation activities within our bureau. I do a lot of the planning for our evaluation activities, and I engage all our stakeholders in their evaluation work as well. So this presentation is really going to be about the basics of evaluation and how your programs organizations can use some of the evaluation steps. So some of the objectives of today's training will be to understand the purpose of program evaluation, explain the different types of program evaluation, and identify 5 core steps of implementing evaluation. So before we get started on what is evaluation, if in the chat box you could enter 1 or 2 words that comes to mind when you think of evaluation. So evaluation is really a systemic and intentional process of gathering and analyzing data, quantitative or qualitative, to inform learning, decision-making, and action. So it is really a systemic process. There's different methods, it's deliberative, and it's definitely replicable. It's intentional. So a lot of the information we'll go over here is the planning and making sure it's purposeful for your organization. And it's also grounded, it's realistic, making sure you're using smart objectives. And it's really based on observations and questions that are related to your program and organization's missions and vision. So the goals of program evaluation is really to strengthen your program. How can you improve your program? And how can your organization be empowered to make data-based decisions to increase effectiveness, to ultimately be able to expand funding? We also use evaluation to measure impact on the work that we're doing. And lastly, it's really important to disseminate the findings that you produce through your evaluation results to your external, internal stakeholders, to the public, to your community members. What evaluation is not, it's not punitive. Just if the data doesn't show what you thought it would, it's not any wrongdoing of any person or team. It's just a learning mechanism, and it's able to help you come up with different hypotheses. And it's really non-judgmental. It's also not biased. We're not just looking for the sugar-coated answers in evaluation. We want to know what really is working and what's not working, and including that in your evaluation is super important to be honest and open. And it's not just about measuring impact, but there's so many different ways you could use evaluation to see how well your program is running, how best to use your resources, do you have enough staff, and other components as well. Evaluation really helps to facilitate learning. It really helps to inform the decisions to make in your programs and improve strategy and impact. So I'm going to briefly talk about evaluation frameworks. At DC Health, we are mostly funded by CDC and federal agencies. So we do adhere to the CDC evaluation framework. And the CDC evaluation framework, it is very intense sometimes, but it is the gold standard of evaluation practice in the work that we do. So it's really important to engage our stakeholders, describe our program, focus the evaluation design, gather credible evidence, justify conclusions, and ensure that we're using and sharing these lessons. Additionally, there are evaluation standards we adhere to, and these come up in the questions that we ask. So we have utility, feasibility, propriety, accuracy, and accountability. I'm not really going to go through these because I don't think they're super important for this presentation, but just wanted to point this out, that this is a resource that your team can use in enhancing your evaluations. So I'm going to briefly go over the different types of evaluations that your organization could do. There's 4 different types of evaluations that we work on. So there's a formative evaluation. This is really kind of a needs assessment. You want to do this when you're starting a program or making any program modifications. So it's really determining whether the program activities have been implemented as intended and resulted in certain outputs. A process evaluation, it determines whether program activities have been implemented as intended. And process evaluations are super useful for program coordinators because this is really showing you if your program is working and how can you make adjustments as needed. An outcome evaluation, it's measuring the program effects in the target population. So by addressing the progress and outcomes or outcome objectives that the program is able to achieve. And lastly, we have the impact evaluation, which also assesses program effectiveness in achieving its ultimate goals. Impact evaluations, usually we do towards the end of the cycle or the end of the program year to really assess if your program did meet its ultimate goal. And the impact evaluation really allows you to make any additional funding decisions or policy changes. At DC Health, our team is really used to working on process evaluations and outcome evaluations, just because we have the most data to support these evaluation activities. And then here's a table that kind of breaks down the different evaluations that you could do. This table also includes an economic evaluation, and that's really just looking to see how much bang for your buck did your program really get. I would stay away from economic evaluations because you do need a lot of expertise, especially economics at the table, to really help you make this evaluation correct. So where do we start when your program is trying to figure out what to do with evaluation, how to approach an evaluation plan, a task? So here are 5 steps that will help you get there. We want to ask, plan, act, reflect, and improve. And as I go through the different slides, we're kind of going to go through each step and what is involved in those. So ask, what are you trying to achieve? What is your program's goal, mission, vision to achieve in the next 1 to 2, 3 years? So you want to do that by prioritizing evaluation questions. So what questions do you have about the processes of your program? Who is being impacted? What kind of evaluation are you looking to do? Are you looking to do a formative evaluation, the process, or an outcome evaluation? And it's really important to document these questions in a Word document, a report, etc., just so your entire team has something to look back at. So here are some evaluation question examples. We're really looking, who are you serving? Are you missing any key stakeholders? What services are we providing? Are those services being provided as intended? And what is the impact? We're always looking to measure to see if we've made a health impact in the district. So at the start, we're always engaging our stakeholders, and stakeholders are those who should be involved in the process or may be affected by it. So within your organization, you're going to have your internal staff, you're going to have external staff, and it's really important to get these people in at the table early on because we all have different questions. We all are involved in programs in different ways. So we really want to centralize how are you going to approach this evaluation that your team has set up and made sure that everyone's at the table. And the last thing to really consider is to making sure that you're bringing in the participants of your programs. Sometimes it does get a little difficult to bring in those people, but they are the ones that are receiving the services and their voices also need to be heard. This is a matrix that we use within one of our programs of using external and internal stakeholders. We really have divided it amongst the different CDC frameworks. So like when do we bring in certain stakeholders to our evaluation and conversation? So as you'll see, certain people have different roles and some of them will help us gather data. Some of them will help us describe our program and focus our program. And it's really flexible. It's really up to each organization and very interchangeable. So what is an evaluation plan? I'll take a brief stop here and open up the chat to see if any one of your organizations has an evaluation plan, a goal, any type of document that you follow. To move on, an evaluation plan is a written document that describes how you will monitor and evaluate your program. as well as how you intend to use evaluation results for program improvement and decision-making. The evaluation plan clarifies how you will describe the what, the how, and the why it matters for your program. So when you're making an evaluation plan, it is a formal document, but it's a document that could change at any time whenever your program changes. Each program year is very advisable, but just the basics to include is the title page about your program, intended use and users. So this is really that engaging the stakeholders, like having that partner matrix here. It really fosters transparency in the purpose and identifies who will have access to these evaluation results. Then we want a section about the program description. So really having a fundamental understanding of your program, which also includes a logic model. The evaluation focus. So this is really where we hone in on those evaluation questions and objectives. What is the primary purpose? What type of evaluation are we working on? Then we have our methods section, which really identifies the indicators, performance measures, data sources, roles and responsibilities of each team member. We lastly have an analysis and interpretation plan. So how are you analyzing the data? What types of methods are you using? And then way to interpret the results. And then we do use dissemination and a sharing plan. So who is getting these results at what time period and when? So we're going to set our evaluation goals and objectives. So the first thing you as a team and the stakeholders you bring in, you want to set your evaluation goal, which is a broad statement. It's abstract. It doesn't need to be measurable, but it does have 3 or 4 objectives that are SMART. And those SMART objectives is really how you're going to determine the success if the goal has met. So the objectives are detailed statements. They're specific and concrete. They're tangible. You could measure them. And it is a roadmap to your goal. And I'm sure most of you are familiar with SMART goals, and it's really important to making sure that these objectives are written in the SMART format. So here are some, when you are writing your goals, objectives, it's also really important to distinguish whether you're going to be writing process or outcome evaluation questions. So here we've listed a few questions, and as a group, we're going to decide whether it's a process question or an outcome question. And just to remind everyone, a process evaluation questions, it really focuses if the program is working on program performance and any monitoring. And then outcomes are really looking at the impact of the program. So I'll read the first question, and in the chat, if you could put a P or an O. Did the program/organization succeed in screening patients eligible for cancer? Is that a process or outcome evaluation question?
We're getting process in the chat.
Yes, that is a process question. Did the activities reach the target population?
Yeah, outcome. Yep, we're getting O's.
That is an outcome question. How many participants were reached during the program year?
In the chat, we have a few folks that said O, outcome. Someone said both, depending.
So this is a process question because we're looking at the number of participants. and it's not necessarily tied to any health outcomes. Are there any problems / challenges that the program needs to address?
Someone said O, someone said P.
This one could go either way. Usually we have this in our outcomes section because it's really addressing any challenges, but we also have the same question in our process. So it really just depends on your evaluation focus. Did incidence and mortality decrease?
That is an outcome, right?
Yes. Did health literacy improve?
And we have outcome in the chat.
Yes, that is a outcome question. And then did completion of homework improve?
We have outcome in the chat.
That one could be both, and it depends how you structure the question. So did completion of homework, if it's an increase in homework completion for the population, that is a process question. But if it's tied to a behavioral change, then it would be an outcome. Great job, everybody. So then now we're gonna get into a group exercise, and I'm not sure if people are up here from the same teams or not, but thinking about your own organization, project, and goals, I really want you to think about one evaluation question that you would have and write that out as a goal. And then to reach that goal, what would be 2 SMART objectives? Based on these objectives, are they a process or an outcome question? So once you kind of determine what your evaluation goal and questions are, it's really important to put these into a logic model. And a logic model is really it provides a picture of how your program is intended to work. It identifies your program main components and how they should relate to one another, and it includes both the process and outcome measures. So these are kind of the different inputs you'll see in a logic model. And then here's kind of a template that you could use for your organization and filling out a logic model. So here are some of the inputs, like some of the resources, the outputs. These are really the activities you guys are working on. Who are you reaching, the participants, and try to be as detailed as possible. And then the outcomes. So this is really looking at the short-term goals, medium and long-term goals. And the short-term goals are like number of participants increasing, medium goals are some kind of behavior change, and ultimate impacts, those are usually decreasing, like incidence, mortality rates, big picture impacts. Once you kind of set up this plan, it's time to act. So it's really time to think about how you're going to gather all this data to help you answer your evaluation questions. So we're really looking at quantitative and qualitative data methods. So with quantitative, so that's really concerning like numeric data, closed and ended questions. You could use surveys, you could use databases, Excel spreadsheets, time logs, whatever is really feasible for your program to use. Qualitative data, we're really focusing on exploring underlying meaning, experience, and perception. So this is typically done using interviews, focus groups. It can also be done using surveys and coding different open-ended questions for some qualitative data. And just some considerations to take into account. How are you going to collect this data? Who's going to be doing it? When will it be collected, and what instruments? So how it's really important to think about the timeframes, like how often are you going to be collecting and making sure that you have staff available to collect this data and then to organize the data. Here's a data collection example template that our program uses. It kind of lays down your evaluation question to the indicator and then the performance measure. So the performance measure is really the data that we're collecting. So once you get all this data, it's really important to organize the data, summarize data through counts and calculations, identify trends of change, and really refer back to your evaluation questions on how you're doing some of the data analyses. So some examples, like if you one of your evaluation questions, like who are you serving? So we're really looking at demographic counts, frequencies. What services are you providing? Counts and calculations based on the different tallies of different activities, services, etc. And then what is our impact? So that's looking at those pre-post test scores and any like long-term rates. Reflect. So when you get done with all the calculations, how do you share those results? I think I had a poll question here. Yes. How does your organization disseminate findings and results? Let me know if when the poll closes. So it seems like reports is the number one, and I would say from DC Health that it's definitely how we disseminate our results as well, infographics, presentations, and all. With evaluation, I think it's really important to consider your audience and stakeholders of how you're going to disseminate the different results. And here I have a picture of a dashboard that we use, and this is for our internal stakeholders. We have a competition between them to really show their monitoring status. We use reports to internal, external funders. Slide decks are really useful for presentations, meeting people out in the community, and making sure you're providing answers to any evaluation questions, discussing these findings, and really using data viz. People are really It's so much easier to look at an infographic than it is a 30-page report. So just make sure that whoever your audience is, the report is being correctly tailored to those. And here's a dissemination matrix that your organization can use. So it's really looking at the audience, the format, channel, sharing findings, timeline, and responsible person. Just helps with the evaluation planning. So when you get down to sharing the results, you kind of have it organized on how your organization will disseminate. And lastly, in the evaluation steps, it's really important to improve, take action, make process improvements, adjust your programs once you find all the data points, include findings in your grant applications, document new evaluation questions and goals, and continuously be repeating the evaluation cycle, because within each cycle, you'll learn more about your program and where you can make any changes and improvements. And then if program evaluation is applied properly, we'll see that you'll be able to verify that the program is doing what you think it is doing. You can identify strengths and opportunities to enhance your program effectiveness, provide findings as input for decision making, improve your organization efficiencies, enhance different funding opportunities, produce data for the public, fully describe the program for others to be able to duplicate what you're doing, and to make sure that equity is ensured for all your programs and evaluations. That's it from me. Thank you for having me, and I'm definitely open for any questions right now.